Okay, so I'm just working up a patient for a PIC placement today, and I'm going to get the patient's name and date of birth, which physician wrote the order, the patient's diagnosis, what they're admitted for, look at their allergy list, make sure they're not allergic to anything pertinent to what we will be doing today, look at their labs, check their platelet count, check their creatinine, also check for if they've had any blood cultures drawn, what their white count is, if their white count may be elevated, running a temperature, any signs of infection. We may want to draw some blood cultures. We check for a consent for medical. I'm going to check the patient's MAR, check what kind of medications they're on. This patient is receiving some antibiotics and has also received some blood products. She's going to be on antibiotics. Also want to make sure whether the patient is on a blood thinner or not. If they're on a blood thinner, we just want to document the type of blood thinner, how long they've been on it, and just make sure if they need any kind of coagulation studies that they've been done.
Is there an INR that you drop off?
Just knowing that it was safer to place a PIC than it would be safer to place some kind of central access. So we're just going to look through this patient's history, see what kind of surgeries that they've had.
Anything specific to the surgeries that concern you?
It just depends on what kind of surgeries they've had. A shoulder surgery or something in the chest, anything like that. Look for pacemaker.
What about lymph node dissections?
Always when we ask our patients if they've ever had any shoulder surgery, anything implanted in their chest, and then check with them about breast surgeries if any lymph nodes have been removed under their arms. Just in case we place a PIC, they run the high risk of having lymphedema with that place.
What happens if you run into a patient with a DVT in the past?
Patients with DVTs in the past, we definitely would want to avoid using that arm and also be highly cautious of placing on the other side.
How about if they've had a stroke and they have hemiparesis?
Preferably avoid that side if at all cost, and use the other extremity. We like to, and also want to, on all of those, just make sure that the vein is of size to be able to hold the catheter.
And what catheter vein ratio do you shoot for?
33%.
Perfect. And is that an absolute, or do you go higher if you had to?
We typically just use that as an absolute. Since we started measuring the veins about 2 years ago, there's been several patients we refused to put a PIC in just because they didn't have vessel size. And we do measure those veins without the tourniquet on. So I'll make note on here while the patient's having the PIC placed. Her history is very short. She doesn't have a whole lot. Also want to look back and make sure in our records whether the patient has had a PIC line placed in the past. I don't see any documentation of her having a PIC line in the past. I will ask her, and we'll just double check with her on other questions about her surgeries and breast surgeries and anything like that.